Good evening. My name is Jennifer Canseco, and I will be presenting Saving Lives, One Nurse at a Time, the Need for Better Staffing Ratios. Imagine this: you are lying in a hospital bed after your surgery. Your call light is blinking for over 20 minutes with no response. The nurse finally arrives into your room and she apologizes because she is responsible for 10 patients during her shift. Now ask yourself, would you feel safe in that situation? According to the American Nurses Association, poor nurse staffing is directly linked to increased patient mortality, longer hospital stays, and more frequent medical errors. My proposition here is clear. Hospitals across the U.S. must adopt and enforce safe nurse to patient staffing ratios in order to improve patient care and nurse well being. Now, let's explore why this change is not only urgent, but it is also necessary and entirely possible. First and foremost, unsafe staffing endangers patients' lives. Numerous studies show that higher nurse workloads are associated with worse patient outcomes. A landmark study published in the Journal of the American Medical Association found that every additional patient assigned to a nurse increases the chance of patient death by 7%. When nurses are stretched too thin, it leads to missed care, slower response times, and dangerous errors in medication or treatment. Safe ratios allows nurses to catch subtle changes in a patient's condition before they become critical. In short, the patients pay the ultimate price when hospitals prioritize budget cuts over appropriate staffing. Second, unsafe staffing doesn't just hurt the patients, it is also driving the nurses out of the profession. Nurses are expected to be caregivers, educators, emotional support system, and crisis managers, all for too many patients at once. This constant overload leads to stress, emotional exhaustion, and burnout. So, according to the National Council of State Boards of Nursing, over 100,000 registered nurses left the workforce during the pandemic, citing unsafe working conditions as a major reason. Replacing burnout nurses is costly and time consuming, worsening the staffing shortage. And better ratio means healthier work environments, which means nurses stay in their jobs longer. And that's good for everyone. Finally, safe staffing isn't just an ideal, it's already proven solution and it takes place and it needs to be adopted. California is the only state that mandates minimum nursing to patient ratios in hospitals. The results? So, according to the Health Service Research Journal, California saw improved nursing satisfaction, lower patient mortality, and no increase in hospital cost long term after the implementation. This just shows that with the right policy and leadership, hospitals can afford to provide safer care, and we need similar legislation at the national level because patient safety should not depend on your zip code. So, what can we do? Well, first, support federal legislation like the Nurse Staffing Standards for Hospital Patient Safety and Quality Care Act, which sets safe ratios across all states. Second, as future nurses and healthcare leaders, we must use our voices to advocate for change, whether it's through professional organizations or speaking directly with hospital administrators. Hospitals and lawmakers must realize that short term cost cutting is creating long term harm for both patients and nurses. To wrap up, unsafe staffing ratios are putting lives at risk, burning out the professionals we rely on, and it does not have to be this way. With the right policies, we can create safer hospitals for our patients and healthier workplaces for nurses. The next time you walk into a hospital, either as a nurse or a patient, ask yourself, is there someone here to take care of me? Or they're just trying to survive their shift? Now is the time to demand change because better staffing saves lives. Thank you.